So hi, I'm Leah. I have been a nurse for a year and a half now, and I graduated from Laurentian University. Straight out of school, I started on the cardiac medical step-down unit at the Sudbury Regional Hospital. What that is a level 2 ICU with a nurse-to-patient ratio of 1 to 2. Right from start, I started as a new grad, and I was under the new grad guarantee, and what that was basically I was provided with training for 6 months. That was very, very helpful because you get to learn the flow of the unit, you get to know what a basic day is, you get to know the doctors, which was one of the main challenges of starting. You might have all your knowledge and you might have your evidence-based practice, but actually putting it into practice is what a lot of the new graduate nurses struggle with. So you do 4 years of school, you gain mass amounts of knowledge, and then you have to start utilizing it safely. We're taught to do patient-focused care, but once you start working you see that it's mainly based on the patient, but there's a lot of outside stimuli that you also have to deal with. You're going to have a manager, you're going to have expectations, you're going to be dealing and collaborating with a lot of different practices, and that is important. And what's important mostly is while you're in school you have to do group work. That actually prepares you quite well for the real world. So coming in, you don't know everything. You have to be able to recognize your shortcomings, recognize your limitations, and do your research. So whether it be asking a colleague for help, or looking at policies and procedures on your own, or utilizing other areas that are open to you. So if you have any drug questions, you call pharmacy. So new nurses usually base their practice on evidence, and then you see with the more experienced nurses that a lot of their practice is based on instinct as well as evidence. But in the time I've started working, I've noticed that my instinct has been coming. I'm able to assess needs and assess patient status. More so now, not staring at numbers, but looking at the patient, seeing any changes. But through the entire process, you need to be open to feedback, you need to be open to grow. You have to accept that you don't know everything. Standards of practice from nurse to nurse that I've experienced and worked with are different. They follow the main CNO standards, but their focuses from all their experience may be on different areas. For providing patients with proper education prior to surgery, nurses will assess the patient, and if the patient is anxious, they won't give the scary part of the information right away. They'll ease into it, they'll talk about what to expect, which at first I was caught off guard by. And then you actually see the benefits of it, still providing all the information, but doing it in a sensitive manner